So those should all come up for a vote as well. What has come up for a vote at least 40 times in the United States Congress is the repeal of the Affordable Care Act. Okay, so let's review this and see how we got to this point. And then what I hope provides us an opportunity to both for people to take advantage of Access Connecticut, who's in the back of the room. Yeah, will you guys wave back there? Who can help people that need to enroll. We have a lot of handouts, I think, that will answer a lot of the common, ordinary questions that people have about this and dispel and debunk a number of the myths. Let me start by assuring everyone who's on Medicare that this act in no way impacts you in any shape, manner, or form. Is everybody clear on that? In no manner, shape, or form does the passage of the Affordable Health Care Act impact you other than it extended the life of Medicare, other than it provided you with greater screening opportunities, greater opportunities to make sure that you get a physical, closed the donut hole with respect to prescription drugs, allowed children to stay on people's policies to age 26, no longer can discriminate against people because of pre-existing conditions, and no longer allows insurance companies to discriminate against women. I'll bet a lot of you in this audience, especially women, were surprised to learn that a C-section delivery during a pregnancy was a pre-existing condition, and that women were rated differently than men because of their ability to bear children and their role and responsibility in the rearing and raising of our children. That has all changed. It also is true that what the act does is make sure that no longer can anyone go bankrupt over the cost of health insurance, because those costs are capped. And so these are important changes. Now, is this a perfect bill? Does it accomplish all that we want it to? No. Was Social Security a perfect bill in its initial inception? No, it wasn't. Was it needed for the country? Yes, it was. Was Medicare perfect at its inception? No, it wasn't. Was it needed? Absolutely. Medicare, especially as it deals with health care, and this is important for a number of people here to remember. Before 1965, when Medicare passed, 90%, I repeat, 90% of all the elderly in this country had no insurance. Why? They were deemed an uninsurable risk by private sector insurance. And so, over the objection of a number of people, a number of groups, Medicare was passed. The statistic today is that 90% of all people over age 65, because of Medicare, have insurance. That's, I think, what it means when we say, in order to form a more perfect union, we come together so that we can allow our government to help provide for its citizens who work hard and play by the rules. Now, let's expose myth number one. Myth number one, Medicare is an entitlement program. Have you heard that? So let me ask you this. When you check your paycheck that you pay, did they take money out for that? What exactly do they take money out of your paycheck for under that? What's that called? Is it called FICA? What does that stand for? Federal insurance contribution by you. So it is insurance that you have paid for. It's insurance that you have paid for, benefits that you are entitled to, not by whim of government, but by virtue of the fact that you paid for it. And so has your employer made a contribution to that as well. So let's get that out on the table right away. That this with respect to entitlements, that Medicare is not an entitlement. It is insurance that you have paid for. Now, usually as well, this is always framed in a way that it pits one generation against the others. How many times have you heard it said, well, here's the problem. It's all those baby boomers, like Steve Harris, that are going through this system right now. It's all those baby boomers that are causing the problem because there's more of them, because a very productive nation coming home after the Second World War saw to it that a lot of people, and the Larson family can attest to 8 of them, became products of our society. So, is it in fact true that there are more baby boomers than there are what people would call, we'll say, for lack of a better term, X-gens? Yes, that is true. But as I said before, have you been paying for this along the way? Yes, you have. And in the process, what else have you been paying for, baby boomers? Have you ever heard of this thing called the Center for Disease Control? Who pays for that? You do. Have you ever heard of the National Institute of Health? Who pays for that? You do. Have you ever heard of the National Institute for Science? Yeah. Who pays for that? You do. And that doesn't count for all the research, all the labs and studies that are going on in our university systems as well. But these are all things that didn't happen overnight. The great strides that have been made as it relates to health care, as it relates to heart disease, as it relates to cancer and diabetes and Alzheimer's, and we can go down the list, and autism, all have come about because we the people, in order to form a more perfect union, invested our tax dollars there to help Americans.